5.5% of the United States population suffered from serious mental illness in 2021. This equates to about 14.1 million Americans that are affected by serious mental illness. Hi, I'm Dr. Sri Banerjee, and in this segment, I'm going to be going over how to not only create a map, but presenting geospatial distribution of mental health providers so that we can see where a lot of providers are needed in order to fulfill the requirements of the individuals living there. So let's go ahead and get started. I've demonstrated how to create this map in multiple places. However, I'm going to briefly review on all of the menu items on the left. Right on the top, you have add, and then from add, you go into county. Uh, you go into search, and then you search for county health rankings. And then on the right hand side, you change the default poor or fair health to population to mental health providers ratio. Now, let me now talk about ratios. I wanted to make a note here. When you see negative 568, you immediately know there's an error. So this is actually less than 568. So ratios work in this way. The lower the value or the number, that means that there's more providers in this area. So, in other words, the population and the mental health providers, as they get closer, the number gets smaller. So, in the all of the blue areas, the deeper blue areas or the blue gray areas, have mental health providers which match the population are closer to that. And what I did is I created a new menu item on the pop up to show you precisely what that ratio is in each county. So let's zoom in here. I'm going to zoom in on Texas because I'm seeing a lot of light blue, which raises a lot of red flags because um, it's a big state and there's a lot of rural areas and bigger cities. So let's zoom in. So if we go even into the cities, which is alarming, for instance, if we go to Houston, there are surrounding areas which do not have providers. And I'm going to show you something that's interesting. So as you can see, the population here, population to mental health provider ratio is quite high. In fact, it's even higher than what is designated within the legend. So let's take a look. This is Chambers County, Texas. Now let's take a look in the neighboring county. That was Chambers County. Let's go over one. So right next door is Galveston County, and Galveston County, Texas, is much closer. It's much better with a lower amount of 753. So 700. Compare that 753 compared to 3,758. So there are hardly any mental health providers in this county, whereas the neighboring county has a lot more. Let's go through the state a little bit more and explore. So let's take a look at San Antonio here. The providers are actually more than sufficient for the population. However, as we go away from the city areas and go further into the rural areas, there is more of a paucity of mental health providers. So, for instance, these values are higher, so you know that the population is not quite being covered. So these are all of the areas which have high and low providers. So I've actually been to Amarillo, Texas, and there's providers there, However, when we go to neighboring counties, um, there's really poor number of providers per population. So this is up to 10,000, which there's hardly any providers for the population, which is sad. So this is the entire state of Texas. What you can do is similar to what I'm doing here. You can go ahead and go to different states and make a comparison. For instance, a good state to look at is Georgia, and Atlanta versus other counties can show some interesting patterns. So this has provided you with an understanding of not only the number of providers, but why serious mental illness and mental illness is still experienced by 14 million Americans, or 5.5% of the US population. So this has provided you with some insight. Thank you for listening.